And we are here now. We're going to be talking about food. We're not going to be serving any, but we're going to be talking about some. So here we have our speaker this afternoon is Miss Shandera Smith. She's a very good friend of mine, and we've been working together for a very, very long time. She has a master's in science and nutrition, and she is a licensed dietitian as well. She actually works with the Ministry of Health as a nutritionist, and she's been working with diabetes for a very, very long time. She does an excellent job not only with her patients, but she's done an excellent job by following her own instructions and making sure that she's an excellent role model. She's also a diabetes educator and a very, very good person to help anyone who needs to talk about diet and exercise and making changes. So let us welcome Ms. Shandera Smith. Thank you.
Thank you.
Good afternoon, everyone. We thank Dr. Mitchell for your introduction, and it's a pleasure to be here to share with you this afternoon. And of course, as she mentioned, we're going to be talking about food, something that is near and dear to me. And if you love food like I love food, I love
Yes.
Awesome. Okay, so we're going to be talking about good eats for healthy feet. All right, so how many of you think that nutrition is really good for your feet as well? I know sometimes we don't really care or check for our feet. We almost, I would say, treat it like a pot cake. But a lot of times we just pay attention to our upper body, our face, but we don't really care for our feet as much. All right, do you think nutrition is good for your feet as well as needed for your feet?
Yes.
Excellent. Okay, so we go through the presentation now. So our learning objectives, so we're going to identify factors that affect foot health, discuss dietary factors that contribute to foot disorders, and then we're going to discuss ways to prevent and alleviate foot disorders through good nutrition. Okay, so of course, what we eat, or I should say food, is the source of nutrients for our bodies. And so in order for the foot to get some good healthy nutrients and to stay healthy, we have to eat the right types of food. And so good nutrition is very important for our whole body and including our feet. And so when we eat nutrient-dense foods, it helps to protect our feet from serious complications of diabetes, which includes foot ulcers, the bunions, all the stuff that other physicians would have talked about. It helps to prevent as well as to treat those foot conditions. And so I'm going to talk about 5 conditions that affect foot health: diabetes, inflammation, obesity, osteoporosis, and poor circulation. Okay, so diabetes. So of course we know when we have diabetes, and of course if it's uncontrolled, we're going to end up with some trouble, because when our blood sugar level stays too high, it damages the nerves, especially in our feet. So we're going to make sure that we don't eat those foods that will cause our blood sugar levels to be high. We want to aim for a balanced diet, which we'll get into more detail in a little while. So we want to have a healthy diet, especially a whole food plant-based diet is one of the major or significant keys to controlling blood sugar levels and managing your blood sugar levels. So let's look at inflammation. Now, inflammation is the cause for almost everything, so that's like almost a foundation for disease development. And so when it comes to the foot pain such as plantar fasciitis or inflammation is caused by inflammation. And of course, it gets worse as we eat certain types of foods like animal protein, especially meats that are high in saturated fats. And of course, the red meats, they're really not so good for our feet. And also when we eat a lot of refined foods, so that can be the refined grains, the refined sugars, and the refined fats, as well as trans fats, they actually help to contribute to inflammation. We call those pro-inflammatory foods, which means they cause inflammation. And so it says that these foods can aggravate other inflammation conditions like arthritis, heel spurs, and painful arches. And so let's look at diet and obesity now. Of course, the more weight we have on our bodies, the more pressure it puts on our feet, especially the bones in our feet. So we have to be really, really careful about our weight. And so we have to do what we can to achieve and maintain a healthy weight. So we put less strain on our feet. So we want to keep our feet healthy as possible. Diet and osteoporosis. Now, of course, when Dr. Johnson, when he presented, you saw all of those diagrams with all of those bones in the feet. And of course, as a person gets older, especially over 55, their risk increase for having osteoporosis. And of course, when the bones are damaged in the feet, it has an impact on the overall foot health or the health of the feet. And so when obesity is linked with that, it causes it to get much worse. So there's an increased prevalence of tendinitis, plantar fasciitis, osteoarthritis, and gout in obese people. So we want to make sure that our weight stays normal as possible. And it says a poor diet that is low in micronutrients can also lead to the onset of osteoporosis, which is associated with an increased risk of fractures and trauma-related breaks. And so we want to make sure that we're eating enough calcium, enough foods with calcium and vitamin D, which can decrease our risk of which can decrease our risk of a fracture. And of course, we know that lifestyle factors like exercise is also important for keeping our bones healthy. And so when it comes to diet, we like to have the dairy foods, and of course they provide a really good source of calcium. But when we have the full-fat dairy products, they also have a lot of fat, a lot of saturated fats. Remember, saturated fats are also pro-inflammatory. And so eating the high-fat dairy foods are not going to help you. So we want to recommend that you have some good sources of anti-inflammatory calcium. So that's our green leafy vegetables, the spinach, the kale, the collard greens, even broccoli. Certain cereals are high in calcium. Certain whole grain breads, juices are fortified with calcium also. Sautés with the bones, nuts and seeds are excellent source of calcium. So you get all the good benefits without having the ill effects of the saturated pro-inflammatory animal fats. Okay, so let's look at circulation now as it relates to the diet. And so when we have a diet, again, high in the fat, the sugars, and the salt, they actually cause the blood vessels to be damaged in our feet and, of course, different parts of the body too. And especially when it's in the feet, it makes it harder for the blood to travel to the feet to deliver the oxygen and the nutrients. And so the foot kind of starve, all right? And so that's where those different, when you see the symptoms starting to come out, so you may find that you have a cut that takes a longer time to heal. The skin color starts to change. You may have cracking in the feet and the legs. And then of course you have slower nail growth and less hair growth around that area. And so the American Heart Association found that a diet that is low in saturated fats, trans fats, and sodium, while rich in fruits and vegetables, can reduce your risk of peripheral artery disease. All right, and also the Journal of Vascular Surgery recommends consuming omega-3s, all right? And omega-3 fatty acids will be found in flax seeds, linseed oils, even black seed oils, avocado, tuna, salmon, mackerel, that's those fatty fishes. And they help to lower the risk for peripheral artery disease. Okay, as I mentioned before, when we have a diet high in fat, sugar, and salts, they do a whole lot of damage to the body. And also edema, where the foot swells or even the feet swells. We want to make sure that we have a diet that is low in fat, sugar, and salt. Okay, so sometimes it's really common, or it can be common or popular for persons, especially if their blood sugar levels are not properly managed, to have wounds. All right, and in order for your wounds to be able to heal well, you have to eat a diet high in good nutritious foods in order to heal properly. So we need enough protein, and protein is a major building block of our skin and connective tissues. And when we don't have enough protein, it can impair the blood vessel formation, collagen synthesis, wound remodeling, and fibroblast proliferation. All right, so having insufficient protein can also suppress our immune system. And so we are able to fight off those infections and different conditions that we may have. So we want to make sure that we have sufficient protein in the diet. And then we also, there are some substances called antioxidants that help to get rid of bad cells in the bones. And antioxidants are different nutrients, especially vitamins A, C, and E. And then we also have some minerals that are antioxidants, the magnesium, the zinc, and the iron. And all of them work together in order to help fight off those infections and help our wounds to heal more quickly and more efficiently. Okay, alcohol and foot health. Do you think alcohol have any impact on the foot? I know in this country we drink a whole lot of alcohol. All right, now if you're diabetic, then alcohol should not be on your meal plan. All right, so of course alcohol has a major impact on our bodies. It actually damages, but excess alcohol actually damages the nerves and blood vessels, which are the two major risk factors for foot ulcers. And they greatly increase the likelihood or the chances that you will get an infection. All right, and they found that nerve damage and excessive alcohol consumption are closely linked, which means excessive intake of alcohol actually causes the nerve damage. So we want to stay away from those. Now, when we talk about excessive alcohol intake, so in terms of the serving size for alcohol, I know that I'm not being misled to know that. For men can have 2 servings of alcohol a day and women can have 1. Now, a serving of alcohol could be like 12 ounces of beer, 4 to 6 ounces of wine, and 1 ounce of the hard liquor like gin and vodka. All right? So each of those are servings, which means females can have 1 per day, men can have 2. Now, when we go over those amounts, that's when it becomes excessive and really dangerous to the body. Now, for some people, of course, not because we said you can have 1 serving a day or 2 servings a day for men means that you need to drink it. If you don't drink, don't start to drink. And if you do drink, you want to actually stop drinking so that you can actually improve your overall health. And so, let's go back one. So, the Cancer Council says that there's no safe threshold for drinking. Even 1 drink can do damage. And when we drink alcohol, it does a serious number on our liver. All right, and we don't want to be drinking or eating foods that actually harm our bodies. We want to consume things that will actually promote our health. And smoking is another one too, a major one. And it seems like smoking is increasing in our country. And for a person who is a diabetic, smoking is not a good thing. Even inhaling other people's smoke. All right, so if you smoke, you want to quit. And it's an early solution if you want to protect your feet. And what smoking does is it deprives the body of those essential nutrients, the vitamins, the minerals, the antioxidants, and it also, when you smoke, you don't get enough oxygen to really go to the different parts of your body to feed the cells. All right, and smoking also narrows the small blood vessels and hardens them. Okay, so that means your feet wouldn't get enough blood and enough nourishment they need to fight off infections and to stay healthy. And it says that many people with diabetes who require foot amputation are smokers. Wow. All right, so try not to bother with smoking. Okay, so let's see how we can use food as medicine now when it comes to diabetes and the foot. So we want to consume or eat foods that eliminate inflammation. And that's mainly a plant-based foods, all right? And we say whole foods. When we say whole foods, it's eating the food in its natural state as much as possible, all right? So let's say you eat an apple. Eat an apple rather than drinking the apple juice, all right? You get much more nutrition when you eat the whole food as opposed to the food made processed, okay? So, and then if the ones that cause inflammation, all of the processed meats, the meats and dairy, the fast foods, the syrup and soft drink that has a lot of high fructose syrup is not good for our health. The fried foods, the refined oils, not good for us. Okay, so what we want to do is have anti-inflammatory foods. So these are the foods that will fight against inflammation. And 12 of the top foods, well, 12 foods really that help to fight inflammation will be papaya, cranberries, red cabbage, hemp seeds, broccoli, avocado, blueberries, chia seeds, walnuts, ginger, turmeric, and celery. And turmeric that's like a master herb, all right? That is so good. It's really beneficial in terms of inflammation, helps to really fight against inflammation in the body. And so complex carbohydrates, so when we choose our starches, we want to choose the ones that haven't been processed. So basically, no white stuff. Choose more of your whole wheat, whether it's bread, pasta, you want to use your oats, try to get the old-fashioned rather than the quick one. Spelt, bulgur, couscous, quinoa, millet, I know these grains are available much more in the Bahamas now. So we want to use more of our whole grain carbohydrates. And also nuts and seeds are very important. And of course we get from these a lot of healthy fats that helps with our bone health especially. And also for healing, we need to have those healthy fats. And when you buy in your fats and oils, make sure that you buy them with one of these descriptions. Make sure it's extra virgin, expeller pressed, cold pressed, or unrefined. If one of those 4 names in on there, leave it right on the shelf. Okay? All right. Now, when it comes to our produce, we want to make sure that we have a variety, all right, of different colors. The deeper those colors are, the richer they are in those flavonoids and antioxidants that really help to promote our health. So make sure get the white ones, the reds, the greens, yellows, orange, purple, there's some brown ones as well. Make sure get variety because they offer different benefits and different nutrients. So in terms of the benefits of fruits, now there's some more. So the berries have a lot of antioxidants that help to fight against inflammation. The fruits high in vitamin C helps with building collagen in our tendons and ligaments and our feet. And when we eat the green leafy vegetables, they have the iron, the fiber, and all of those other good nutrients that help to prevent type 2 diabetes or help to manage type 2 diabetes, obesity, and high cholesterol, heart disease, all of those other chronic conditions, as well as cancer. And of course, we want to encourage you to have more of our native fruits. All right, our native fruits, our native produce. The secrets, of course, these are seasonals, and whenever they're in season, that's when we eat them. All right, and of course, we have some in season all year round. The cocoa plums, the sugar apples, the soursop, bananas, the guavas, the ganaps, coconuts, mangoes, all of those. So just eat the native fruits. But of course, we're going to eat them in the right amounts. Peas and beans. Now, traditionally or culturally, we just like to put peas in rice or in grits or in soups. But we can do so much things with peas and beans. We can make salads out of them, burgers, meatloaf, patties, meatballs. We can put them in our salads. We can do almost anything with beans. And actually, you can do more with beans and peas than you can actually do with meat or animal products. So we want to make sure that you use, try to get some peas and beans in your diet every day. Lots of fiber and different minerals that really help to promote our health. Then we have our herbs and spices. All right, so this is like your herb or your spice cabinet is like a medicine cabinet. It has a whole lot of benefits, a whole lot of health benefits. And especially when it comes to inflammation, there's something like the turmeric, the ginger, all of those, they're really good at preventing inflammation. And of course, they taste really good. Once you put them with the right food, delicious. All right, so we want to have a variety of foods when it comes to our diet. Let's not be eating the same chicken and rice and corn every day. We want to mix it up, eat different foods. All right, have a variety as much as possible. God made so many different foods. Just don't eat one particular ones all the time. Get a variety. All right, so earlier I talked about having more of a plant-based, a whole food plant-based diet. So we want to make sure that when we have our meals now, all of those foods that I just talked about, so we want to put them in the right balance. So when we eat, we want to make sure that a quarter of our plate is grains, a quarter is protein, and half is vegetables. All right, the only difference between the animal and the plant-based ones is merely the choice of protein. All right, and of course, the plant protein is more health promoting than the animal protein, especially protective for our kidneys, and it confers less inflammation on our bodies. So for persons with diabetes, we like to show you this bit that makes it really simple, so you can see what the carbohydrate foods, because the carbohydrate ones are the ones that really influence the blood sugar levels. So the foods that the greens and starchy vegetables, the milk and yogurt, sweets and desserts, and fruits and fruit juices, they are the carbohydrate foods. So to make sure that you eat them in the correct portions. Then we have, of course, a quarter protein and half vegetables. And then in this other slide, you can see an actual meal. So we have half of the plate being vegetables. There's some salads, some broccoli there. Then we have some bean and rice, and we have a piece of chicken, but that can easily be a plant-based protein there as well. And we also want to look at the size of our plate. Very important. All right, so for females, it's a 9-inch plate, and for males, it's 11 inches. But if you need, for the males who need to lose weight, you can actually use a 9-inch plate. And water is another really important nutrient to have. It actually helps to deliver nutrients to different parts of the body, helps to flush the body of toxins, Also, you want to avoid adding sweeteners to your waters. Add some fruit instead to your water. You can add some cucumbers, some ginger, some lemon to your water instead. And also, if you're taking medication, of course, you need to drink at least 2 more cups of water than you would normally drink. And of course, certain supplements as well, you need to drink more water. So in conclusion, you want to make sure that you eat a balanced, whole food, plant-based diet to prevent nutrition deficiencies and to get sufficient or adequate nutrients. But if you do eat meat, you still want to make sure that you eat the right amounts, all right? A quarter, the palm of your hand without your fingers, that's the amount of meat you should have at your meals. All right, any more than that, you're hurting yourself. Okay, your fist is the amount of starch on your plate, that's like 25%. If you actually put your fist on your plate, that's like 25%. Your 2 hands with vegetables, slightly pull apart, that's like half the plate. And once you eat balanced, trust me, things get much better, you'll experience better health. Okay, use your anti-inflammatory herbs and spices, drink enough water, minimize your intake of pro-inflammatory foods such as refined sugars, refined grains, trans fats, saturated fats, and sodium. And also you can use supplements if needed. And I know sometimes, especially when persons are getting old, their appetite sort of decreases a bit, and they can't get enough nutrients or nutrition from their food. So they may need to have supplements, but always be guided by your doctor, a dietitian, a health professional who knows what they're doing when it comes to supplement. And then you want to achieve and maintain a healthy weight. Limit the consumption of alcohol or do not drink at all. Do not smoke. If you do, you want to quit. And of course, you want to get regular exercise to strengthen your muscles and bones. And so we want to put thumbs up for anti-inflammatory foods and thumbs down for pro-inflammatory foods. Okay? So remember that what you eat affects your feet. So we want to have healthy eats for healthy feet. Okay? Okay, any questions? Right from the back.
I'm great. Why are people eating so much Crisco, Mazola? Why are these oils that are PUFAs, polyunsaturated fatty acids, like you're saying, very inflammatory? And you got all these coconuts growing here, so why not just do it coconut oil? That was an excellent presentation, I wanted to say. Spot on. You're welcome. But why is Mazola, why are these other oils that they extract? Even the flaxseed is extracted with hexane, a gasoline product. And so it's the extraction process that makes these oils polyunsaturated fatty acids and mega fatty acids.
Yes.
Coconut oils are different, they have a different flash point. But I wanted to compliment you on your lecture, just absolutely. And I wanted to taste the cake I heard about. Well, cake. Do you have samples in your car? Did you bring to the anti-inflammatory cake? Okay, sounds good. But thank you very much. Very good.
But you mentioned those facets. So they're the ones that are more popular, they're more promoted. And so because they're sold in the stores and we use them from young or our parents use them, we tend to use them without thinking about how they were produced, the effects they have on our bodies. That's why I put that. I think once it's not refined, so make sure it's unrefined, expeller press, cold press,
Right.
or extra virgin. If
Right.
there's not those things in it, do not use it.
Right. Nice.
I keep on, I don't know, even though I have some of them literature. How do you eat fruits as diabetic? How do you eat fruits? And yeah.
Okay, so
What I mean, you understand what I mean? How do
Like
you
how
eat
much-
fruits like, okay, in portion, let's say I'm eating breakfast and I have some, let's say maybe grits and tuna. I could eat fruits too?
yes, but I want to have some vegetables along with that grits and tuna.
Oh.
Well, actually, I don't really like to promote grits eating that much because grits don't really have a lot of nutrition. You can get more nutrients by, let's say, using bulgur or some whole grain rice, or some other kind of whole grain rather than grits. And that's just some real serious added grits with plenty fiber, then yes.
I use the yellow one.
Make sure it's really coarse, take a little while to cook.
Okay.
Yeah, so that's where you actually get what you said. So when it comes to blood sugar management too, the more fiber, the better it is too. So whenever you're thinking about your meals, you gotta make sure that it's a high fiber meal.
Okay.
All right. So you mentioned. So let's say you have the first step to make sure have some half the little vegetables. So every meal you have, you're gonna try and balance it the same way. It may seem strange eating vegetables for breakfast, but that's one of the best things you can do to really promote your health is to have veggies for breakfast. All right. So you want to make sure that you follow that pattern all the way, and all of your meals try to have vegetables, and you'll see how much your health actually improves.
So in that portion there, like you said, you break.
What is you can have a fruit, you can have a fruit as an appetizer to your breakfast. That's fine. Now, in terms of the serving sizes, so if you want to have a small apple, small banana, that's like 1 serving of banana. Let me give some length. So let's say a 5-inch banana is about a serving. If you eat one more, twice that size is 2 servings, and that's okay. So you, of course, when you take your medication, make sure you take your medication. If you prescribe medication, to make sure that everything stays under control. It doesn't mean that the food actually set it out of control, but if your blood sugar levels are high already, and you eat fruits and not really balancing your meals, it may cause the sugar levels to go higher. All right, so remember that as diabetics, you're always supposed to be monitoring. So once your sugar levels are normal before your breakfast, you can enjoy your fruits, and then you probably have up to 2 servings of fruit, but of course balance it with the other part of your meal. So what other carbs are you having with your breakfast? All right, so make sure it's not more than 4 servings of starches for females, and not more than 5 for men. So once you stay within balance, then you should be fine.
Yes.
Yes, ma'am.
Yeah, I just want to ask this question. As we develop, parents feed their children a lot of cereal.
Yes.
Now, could you give us your take on, what's proper there? Because you have from Raisin Bran to whole wheat, so shredded wheat, and all of these, yes, and and the children are just blowing up.
Yes. So those sugar-sweetened cereals, they're like dessert foods. They're like eating cake and pies and different things that are based on, well, for all the sugar that they actually have in it. So in terms of good cereals, oats is one of the best ones to actually have. And oats is so versatile, you can do all kinds of things with that. And another thing to do when you're purchasing cereals, look at your ingredients list, or any food for that matter. What you want to do is recognize all of those ingredients as being actual food. If you see a bunch of the different chemicals and stuff in them, the different dyes and the different preservatives and additives, that's not the best thing to put in your body. All right, and as you mentioned, they're blowing up. So even some of those additives and preservatives, they actually cause us to be sick as well. So that people have allergies and eating foods and don't even know why it's happening to them. But we want to eat real food as much as possible. So if parents can even not give cereals to their children, they'll be much better off. But if they must have cereals, I usually recommend the oats or any kind of whole grain cereal for children and adults to have. And then the milk that they put in it, another story, but use more plant-based milk rather than the animal milk. Any other questions? Okay, well, thank you very much.
Diabetic, had years of this. So mommy had the problem, family members have the problem, everyone had the problem. She had given up. And she was like, oh Lord, I ain't gonna never get out of this hellhole of these feet. And I convinced her with minimally invasive surgery we could do these things to her. And it's an ongoing thing. She's a tall lady, right? And so today we're going to see this the base of this fifth hair. These are vexing lesions for the general surgeons. This has to be fixed bony. So we've resected this fifth toe, which is fine, but this lesion now is at the fifth metatarsal head. So we're going to resect that head with an osteotomy, sliding wedge right through it. Boop, it's going to pop right up. This thing is going to go away forever. These toes here bother me a little bit, 2 and 3. I said yesterday about the neuropathies. When the neuropathy hits, The intrinsic, see when I do my hand like that, that bumps up, that's a muscle, that's an intrinsic muscle. In diabetics, you look at that and there's just skin, okay? There's nothing there. That's the neuropathy affecting the intrinsic muscles, okay? It should be up, and in a lot of diabetics, there's nothing there, the intrinsics are gone. So when the intrinsics go, the toes do that. So this works by something called Wolff's Law. Wolff's Law, okay? It's form determines function. If you put something in its right place, it'll function accordingly. So the ligaments, tendons of the foot, if you put the bone in the right position, don't do anything to the bone, let the ligaments and tendons force it into its right position based on you using it. So I let people walk on my work because I want all these bones now to fall into line based on the right position. I mustn't artificially put her foot in a position because I don't know what her body does when she stands up. She might have a tight Achilles tendon. She might have a hyperflexible forefoot, right? She might have one leg shorter than the other. She might have scoliosis of the back. That's going to change the way she walks, and you don't know how much. So no pins, no screws in this work. No pins, no screws. So the way we're doing this work now, cameraman, I don't know if you can catch that, my little funny diagram, is to establish the cause. We're looking at the lesion is here. These are these ulcers, the most common being the great toe. We are wanting to take the pressure off of this great toe. And what do? Angle of attack through the metatarsal head, a small wedge osteotomy at this angle, bringing the metatarsal head a few millimeters up inside the capsule, taking the pressure off here and off there, eliminating the abnormal forces and allowing Wolff's Law then to interact with her forefoot, and we will have healing. She has a blood supply. I can feel as a bound. Put your fingers right there for me. When I move mine, put yours. Feel that? Bounding pulse. Okay? So actually there, she has the pulses. On the side here, you can feel her posterior tibial. All right, bounding pulse again. She has decent skin. This is a little change. Of course she's had problems. They had given up on this foot. We bring it back to life. Now, you have to go in and fix a few things. So today we'll be doing osteotomy, tenotomy to this toe. I'm going to straighten this toe because she's walking on the nail. I'm going to straighten that toe. This one's okay. And we can do the osteotomy. You ready?
Yes, sir.
Boom, boom. Let's go. As long as she's ready, we're ready. And they see all this stuff coming, right? And it is all I need, Dr. Thompson, to make sure that you all know to tell people, look, and then them toes, this thing you're walking on the toenail, it's gonna ulcerate, man, let's fix that, right? And I say let's, because I want you all to be able to do this work soon too. My job as a consultant at the ministry is not for me to be doing all this work, So I keep telling them, I say, for me to show you all to do the work. But they like to come watch me do it. I'm like, no.
Yeah.
So now that's interesting. So yeah, when I first started working on her, you could have just cut her. You could have gone ding ding because she had neuropathy so bad. We have attacked her. So that thing about you can't treat neuropathy, not true. So the first thing she said is now make sure he make my toe now. You know what I mean? She got feeling. Yeah. Cause. Okay, so I'm very happy when my patients, so normally most doctors be like, oh Lord, I want this person to feel this. But I'd be overjoyed when someone say, ooh. I'm like, thank you Lord, it's working. So for them we have to get their sensation back in their bodies. Let's do this one first, right in the middle. So we can do this tenotomy, osteotomy here. So picture that thing on my chart there where I'm showing you all. I'm going right to the top, right in the bottom. You feel that? Not much, good. Right to the top, right at the bottom. Ooh. Mm-hmm. It's a Good Friday song, man. So this tenotomy is interesting. Ding, 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 ding. So when I'm right to bone, so all my work is right to bone, okay? Similarly here on this fifth, I know turn your foot a little bit to the side. So we see that's our lesion. So I'm gonna make hair numb, and then there, and then I'm gonna cheat. All right, now for me it's a little easier for me, as I tell my nephew earlier, I've done 10,000 of these now. So I'm trying to get a feel for it. Do you feel that, Ms. Poitier? A little bit, good. So this is someone we also, just for the camera's sake, see she jumped just now. Very good news, Mitchell. She's been on our neuropathy protocol. And so when I stick her, she's jumped. And boy, is that good. Why? Because for these people, I want that when they stand on something, I want her, when she stand on something, I want her to go out. As opposed to when she walk on something, just walk right through and say, oh, I think I hit something, but I'm not sure. Bad news. Okay? And then you're going to go straight across here. Foot just. So on the bottom of the foot now, you have this, the plantar apparatus, and the two nerves that coming in off of the posterior tibial nerve. Okay? And the plantar, medial plantar, it splits right here. You got the medial plantar nerve and the lateral plantar nerve. So if I wanted to turn off a whole foot, we could also turn off the posterior tibial nerve. I don't do it often because it's close to the posterior tibial artery, and once again, in a diabetic, if ain't nothing going on in different parts of the foot, don't bother it, because you might injure something or hit something that there's nothing wrong with it, so don't do it. But we could turn off at different segments, the nerves here. The common perineal comes out here just at the head of the fibula, the fibula head. Common perineal comes beyond that. It divides. You can get the lateral, the perineal there. You can get the deep perineal that comes right through the anterior aspect of the ankle. And the right beside dorsalis pedis dives in between the first and second metatarsal. Okay? And you can do blocks at any stage there, turning off the different parts of the foot. All right, so she's there. We can do one more thing in my little cheat moment. And we want to see where we're going. So we're going to take a picture now of my incision spot, which is going to be right here. X-ray. Shooting. Good. Okay, so you can see there what's going on with these. So you see that with former ulcers and old osteomyelitis is a grade 2, which is healed. That's so osteo can heal. This thing about you got osteo at a grade 2, it can't heal. That's osteo of the grade 2. We heal that up. Okay? And the toe there, and she walks on this. So now you have the second and third are pretty competent, but the toes are retracted. So you can see on the fourth, you can see the proximal phalanx, middle phalanx, and distal phalanx. On this one, you can only see one. Okay, so you're dealing with something that looks like this. We want to straighten them and make sure these are more involved in this gait, because of this moving now, they're going to want to go this way. And then we're going to come to this fella here, and that is dive. So now, you can see the spot, I'm marking that. I think I go a little distal, and I want her to turn her foot. I want to get like an oblique of this. So leave your foot just like that. And there's some juicy technology, you know. Leave your foot just like that. Good. Okay, shoot now for me. Shooting. Good. Okay, so now we get a different view of the deforming process here as to what's happening in there. And you can see this fourth really has fractured. The fourth is an old fracture. Okay, so this is also pathognomonic. This is a phrase, it's pathognomonic. In the diabetic foot, this isn't a Charcot yet, but this is a foot that is certainly going through some changes. Now let's get a frank lateral if we can. So leave your foot just like that. It's going to start spinning to you. Shooting. Okay. Good. Okay, so these are all the other metatarsals. So this is a lateral now. The Mets are going this way, and that's the fifth. It's out there on its own. Okay? And we have our marker just underneath it, so I know I'm going still back in that spot, half a centimeter above, and I'm going to go through this fifth because I want this head to be level with that head. Can you see that? I want this head to be level with that. The fifth metatarsal is down on its own. Rolling, let's go. The toes, you can see, because of the neuropathy, have changed, dramatically changed shape. They had a reabsorption of this fifth, and now you have an ulcer under here because the fifth metatarsal, not the toe, the metatarsal has dipped its plantar flex. And so the procedure today is to do an osteotomy that brings that in line with the others, because that's the design. If all of them bear weight at the same time, you can go for 100 years with no problem. One sticking out on its own, it's gonna break, it's gonna burst. Classic Bayman phrase, pressure boys pipe, right? There's too much pressure on one side. Then we're gonna do tenotomies on these toes and straighten them. I like to work from smaller to larger. And when you go to an open wound, the procedure should be done. You can't go from the wound into other sterile areas. Okay, the reveal, and we begin. The tenotomies, which we have not demonstrated yet in our cycle, you mean 67, are done on the flexor and extensors at the same time, okay? So we really call it a flexor set. So you're taking something that is like this and making sure it comes out straight. If you only do one side, you can end up with just another problem on the other side. So you got to do both sides. And once again, you know, people who feel it's difficult operating on a diabetic foot, it is. But if you got the right equipment and this technique, staying in the middle, you will be fine. Okay, Ms. Poitier, we're going to begin. I'll show you on the top. So these are the tendons. They're very tight, very taut. Okay, see how when I leave it, it just pulls right back up. She's walking on the tip of her nail, and this is going to ulcerate from time to time. She's tired of it, and we won't take no chances with it. So here we go. We do the top of the flexor. See, I can feel that there. Okay, I go underneath it. I'm in, right? And then watch, you're going to just hear, boop, and the toe comes down. That's it. No less, no more. In a tiny hole, and I'm coming out. Don't get too excited. Same thing underneath. I want to do the same tendon underneath, right to bone. Okay. Come around a little bit. I want to feel where it is. I can feel it. Ding, ding. I don't know if y'all could hear that. Can you hear that? That's the flexor, so right at the top is the extensor. Ding. Okay. And you see we're releasing the pressure. So what we're doing with this procedure is trying to eliminate, this is tendon balancing, okay? I'm wanting to balance the forces, the abnormal forces of her tendons on her foot. Now these, once again, don't let these feet fool you. Tendons on feet are very strong, okay? This carries your body around, so you don't go fooling with this and thinking you're doing a little tap tap. You're going to have to pull the toe once you've straightened it. And you hear that? Lovely. In that joint a little bit. Okay, hear that again? That's that tendon. That's how hard the tendon is. That's how strong it is. Nice. Okay. Feel it stretching. See that? Okay? So when she walks now, we want her to, this toe can do that. That's all. You don't have to do nothing fancier than that. We could do bone, you could, a lot of more things you could do, but high risk person, diabetic. So in the top there, you see how that sits straight now? Can you see that from your angle, Dr. Mitchell? How that's sitting as opposed to that hammering. That's just a tendon. We could do more because you can go in there and change I could do a capsulotomy and I could do an osteotomy. But you do as little, this is minimally invasive surgery. You do as little as you need to get the best result you can. Don't do too much. And I can come back, you could come back one day and do more. Don't get excited. Okay? And that's why I kind of like it. I'm by nature a minimalist. I don't want to do things you don't have to do. So once again, you're feeling that tendon. Okay? It's just like on your hand. Okay, I'm in. Can you hear that? Okay. I'm going to go underneath him. Can you hear that? Okay. And I just release the tendon. Okay. I'm wanting now to just make sure you have a little capsule tight there. So I can do a capsulotomy on this fella. Take a little bit out of the capsule. Boom. I'm going to come underneath her and do a flexor set. Okay, so these tendons now, they're pulling so hard on her. You got them to just release and relax, man. Which kind of all of us need to do now. Relax and release a little bit. Hear that? That's how strong these tendons are. It's a blade now. That's how strong they are. Bam. Okay. And they're sitting a little better. A little retraction in here too. Relax your feet and split you. There you go. So everyone unconsciously when you're doing this, they wiggle in their toes. And it could throw you off a little bit, doesn't matter. Yeah, so there's 4, not bad. So this your 4th joint is fusing a little bit, but that's sitting up nicely. And I'm wanting to, while they're relaxed, I'm wanting these to sit in a position and when it hits the ground, they'll conform. I think homeboy here could come up a little bit. Okay, so this is flexible. I've got a little more flex. I think we can get a little more out of this fella. Let's see if we can get you a little more option here.
Yeah. All over it.
Okay. Okay, how's that look? Okay, and that's in a relaxed position. See, she's still wiggling her toes. But it's in a relaxed position now, they're gonna hit, and before we did it, these nails, see the tip of this nail? That was under the toe, she was walking on the nail. Now, you should be able to, I can bend it, you could see her nail. Okay, she's not gonna be walking on the nail. Perfect. Alrighty. Now, so she still won't see, so she's still pulling her foot up, no problem. So now for this incision, you're going behind here, right into this, and then boop, you can pop that right up, and we're good to go. Also a minimally invasive, so turn your foot a little bit to the side, you can relax, relax. Put you in a relaxed position, relax your foot completely. Okay. Minimally invasive surgery, another thing we used to do when we was at the hospital, you had to call the family for blood. What people hate to hear that. You think, but what's going on here? With this stuff, you don't want to have no diabetic on the table, and you call down, send Dr. Thompson, go down to the blood bank, see if we can get Shifus. You want that, okay? You don't have that with this surgery. And they're big vessels in the foot, but you're going in between the blood vessel and in between the nerves. So that's why I'm feeling here to make sure I'm on the capsule, and there's no tendon. It's the blood vessel's there, and there. Nerve is here, and there. Lesion here. Not touching the lesion either. I'm going right here. Okay, and I'm going right against the capsule, onto bone. And we're on it. in it. I mean, boom, that's it. No less, no more. All right, give me the burr, Felicia. Down. Okay. We're jamming. Any questions for me, Ms. Boytier? All righty. You've been a great patient, a good trooper. We're happy to do this work for you. And this is what New Hope is about, Dr. Thompson. It's giving people, we can't keep telling people we can't help you. They're looking at us like, well, what you all trained to do? Give out tablets? Would we work for the drug company? I mean, what are we here to do? We here to fix stuff, man. Yeah, so let's go fix it. I get a kick out of fixing things myself, to be honest with you. I get very frustrated when I see people and I cannot help them. So this is New Hope for the diabetic foot. Lesion is there. See a tiny incision we made on the side here. You can hardly see it. You go in there. I'm on the bone. We tested it with the pin we left in on the x-ray. That's bone. Okay, watch my angle of attack. I'm going to make sure this finger, I'm guiding myself to that point. Okay, I'm going right through that bone. I'm in the metatarsal, what we call the surgical neck. You can see the lesion now. Remember I showed you on my little diagram where when I come out on the other side of the bone, I'll be above the ulcer though. Okay, but not on the plantar aspect, on the dorsal aspect. Okay, and we're going right through this. When this is done, we're going to have the highlight of the day. We'll take some pictures of Dr. Mitchell's toes, and maybe she'll one day let us video a diaphysectomy on her. We'll take some pictures today to see how. Well, the conference is still on, people. We're videoing this to be shown. This will be shown. Okay, and so we're through on the other side. And now we're going to do a sliding wedge, as I showed you, against there. Hear that? So when you hear that, we're through and through. Double check top and bottom. Good bone stock here. See, that's my finger here. I'm always feeling on that side. Not that you could come through the skin, but if you get too zealous, anything could happen. Okay, but you'll feel the vibration as it comes up through the surgical neck. Hear that sound? That's bone. So this cuts bone and breaks it up into a tiny paste. And I was telling Dr. Thompson earlier, Dr. Mitchell, that paste is bone marrow. So it's mesenchymal cells, stem cells, they're your own stem cells. Which for wounds, I love that around wounds because that's going to increase healing. For diabetic, it does a world of good for them, and that's the bone paste. You see that stuff coming out now? That's not blood, it's bone paste. Okay? Bone paste coming right through there. And now, bam. Felicia, you're gonna take a picture. We're gonna get out of Dodge. Okay? And try to see if I can do this as neat as possible. Should get one longer. See, this toe showing off now. He never been straight in the whole life. Take your time, man. You ain't been straight for 20 years. Now you the one. Look at me. Now you the one sticking up. That's the one who was diving down. This the one who would do jerk down. Now he up. Relax, man. Well, you're just happy to see a nail in this point. And what's happened to the head? The head now is gonna say slid over. That's all we need. Right? Boom, we're done. We're jamming. Lovely. How you feeling? Any pain, any problems? No, sir. So, and that's 67 MIS blade now. Yeah, you don't have to go back in there and put no sutures in that. Leave that. Her ability, she's healthy enough, her clotting factors have enough juice in them. That's gonna close. Don't go in there. Once again, not fooling with any tissues you don't need to fool with. Leave it. Just dress it. And she'll be jamming. Good. And when it's hard, as the day goes on, people get a little tired, a little more tired. I'm not sure their hydration, how much they eat, what their status is, that type of thing. Good. So same thing, put your hand right there for me underneath there. Boom. And get him to behave. He's dressing. So. And in minimally invasive surgery, Dr. Thompson, the dressing is as important as the procedure. It really has to be perfectly done, well balanced. So come around here, and you see now what we call the parabola of the toes. A line, a smooth line. So before her toes were like, we started out and the toes were like this. Now when you look at this, look at that angle there. See, I'm not touching them, but they're in, see that? They sit on one arc. That means when a foot hits the ground, it's like playing the piano. It's gonna ding, 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 on this level. It can take more pressure. If one's up, one down, one's stuck in the corner, it's gonna break up. The music just ain't playing right. Okay? But now these are sitting without us doing anything, no pins, no screws, just tendon balancing. They're sitting in a nice position. Fine. We're good to go. Bam. See ya.
Thank you.
Have a good weekend. Good, now don't jump up and leave yet. My part over. You're so sweet. Keep going.
I had a lot of issues with my feet. I went to Saudi Canada and I had an ulcer, and Dr. McCartney was there and he told Dr. Johnson to come and look at it. Yes, in 2018.
2018.
Yes, ma'am. And he looked at it and he said, you'd have to fix that. That also, that he fixed that also gone, but another ulcer came back. Another ulcer. I had like 3 different ulcers on this one foot, but Dr. J did wonders. I mean wonders. Because I know I would not have been able to be walking like how I'm walking. And with the big toe too, I had a problem with that also. And you see them? They're awesome. They are awesome. They treat you like family. You understand?
So what advice would you give to other diabetics in terms of, I know that control of the sugar is important, but what other advice would you give them in terms of giving them hope? As you've had this experience, what advice would you give to them?
Well, my advice to them is that you take care of them. Take care of your body. Especially that whenever you see something is not right with your foot, you need to check it out. Come to Dr. Johnson. Dr. Johnson will tell you what he saves limbs. You understand? And without him, I think I would have lost my foot already. I would have lost that already. But like I say, the doctor say, awesome. Awesome.